Okay, let's talk about something you might have wondered about. That nagging back pain, could it actually be connected to your stomach issues? I know, it sounds a little out there, right? But for millions of people, the spine and the gut are absolutely mysteriously linked. So in this explainer, we're going to dive in and figure out why this connection is so critical. Let's get started.
So picture this. You've got this chronic back pain that just won't quit. And maybe, just maybe, you've also got these persistent gut problems. You're probably thinking, am I just unlucky? Are these two totally separate things? Or is there a deeper connection? Well, that is the exact puzzle we are setting out to solve right now.
All right, to get to the bottom of this, we first need to get to know the two main players in this medical mystery. On one side, you've got an issue with the spine, and on the other, a problem deep in the gut. First up, we have spondyloarthritis, or SPA for short. Now, this is really important. We're not talking about your everyday, oops, I lifted a heavy box kind of back pain. No, this is a whole different beast. It's a group of chronic inflammatory diseases. Basically, think of it like your body's own immune system getting confused and mistakenly attacking your spine and joints. And the result? That persistent, deep pain and stiffness. And our second player in this story? That's inflammatory bowel disease. You've probably heard it called IBD. It's really an umbrella term for two conditions you might know, Crohn's disease and ulcerative colitis. The key word here, again, is chronic inflammation, but this time it's happening in the gastrointestinal or GI tract. So, what happens when these two worlds collide? You might be surprised. It is way more common than you'd think. Get this. Studies show that somewhere between 6 and 14% of people with SPA also have IBD. That's not just a coincidence, folks. That is a clear medical pattern that tells us something important is going on here.
Okay, so we've established there's a connection. The big question now is why? And what does it all mean for patients? To figure that out, researchers have been playing detective, digging for clues. Let's take a look at a really big study that tried to piece this whole puzzle together.
And that brings us to this huge international study, the ASAS per SPA study. We're talking about researchers looking at data from over 3,000 patients with SPA. And their main goal was to zero in on the key differences. What makes SPA in a patient with Crohn's disease different from SPA in a patient with ulcerative colitis? And you know, what they found at first was pretty surprising. When they just looked at the back pain, the two groups looked almost identical. I mean, whether a patient had Crohn's or ulcerative colitis, a huge majority, we're talking 90 to 95%, had that chronic back pain. So on the surface, their arthritis seemed exactly the same. But then they dug a little deeper, and that's when the crucial clues started to pop up. Okay, so the back pain was similar, sure, but there were these really key differences. For instance, patients with Crohn's were much more likely to have a specific genetic marker, HLA-B27. On the flip side, patients with ulcerative colitis were more likely to have other inflammatory issues, like psoriasis on their skin or a type of eye inflammation called uveitis. Right about now, you're probably thinking, okay, a genetic marker here, some skin issues there, so what? Why does that even matter? Well, it turns out those seemingly small clues are actually the key that unlocks this entire mystery. And it all boils down to one critical thing: treatment. And this study's conclusion really says it all. Knowing whether a patient has Crohn's or ulcerative colitis isn't just about putting a name to the gut problem. It is, and I'm quoting here, vital for figuring out the right treatment strategy to get the arthritis under control. So this was a real breakthrough. This new understanding has led to a much clearer approach for doctors. We now have what you can think of as a modern treatment roadmap, a set of clear guidelines that helps them navigate these really complex decisions. And here it is. This is the 2025 guideline from the British Society for Rheumatology. I know at first glance it might look a little complicated, but this flowchart is an incredibly powerful tool. It gives doctors a clear, step-by-step path to follow when they're managing patients who are dealing with both of these conditions at once. So let's break it down a little. The first few steps are pretty logical, right? First, confirm the diagnosis. You gotta know what you're dealing with. Then, you start with the basics. Things like physiotherapy and NSAIDs, those common anti-inflammatory drugs. After a while, you check in. How's the patient doing? If things aren't getting better, that's the signal it's time to move on to more advanced, targeted therapies. And this is the moment. It's at this exact stage, choosing that targeted therapy, that knowing the details about a patient's gut health becomes absolutely critical.
This is where the roadmap has a major fork in the road. So imagine you're a patient. You have SPA and you have active IBD. This right here is the million-dollar question. Which of these powerful drugs is going to help your back pain without, and this is key, without making your gut problems even worse?
Well, the guidelines give us a really clear answer. As you can see, some classes of drugs, like monoclonal TNF inhibitors and JAK inhibitors, get a thumbs up for both Crohn's and ulcerative colitis. They work well. But look at that last row. IL-17 inhibitors, they are a definite no-go if you have active IBD.
And this is the whole point, the crucial insight. IL-17 inhibitors are a fantastic and super common treatment for spondyloarthritis on its own. But, and this is a big but, they can actually make active IBD flare up or even get worse. So picking that drug for the wrong patient could have really serious consequences. And that is why those subtle little clues we talked about from that big study are so incredibly important.
And you know what? It's not even just about the gut. There are other conditions that often travel with SPA, and they influence the choice too. For example, if a patient has that eye inflammation, uveitis, certain drugs are going to be preferred. If they have significant psoriasis, a different set of drugs might be the best choice. It just goes to show you absolutely cannot treat these conditions in a vacuum.
Which brings us to what I think is the most important takeaway from all of this. Real, effective care isn't just about the diagnosis on a chart. It's about seeing the individual person and understanding their complete health story. You can see that the new guidelines are built on these exact principles. The goal isn't just to make a number on a blood test look better. The real goal is to optimize your quality of life. And how do we get there? Through shared decisions made with you, not just for you, and with a whole team of specialists who are all looking at your unique, complete picture. So, the mystery of the spine and the gut. I think we can say it's solved. The link is very real and it has huge implications for treatment. Truly effective management isn't just about targeting the back pain or just about calming down the gut. It's about understanding how all the different pieces of your health story fit together so you can choose the one single path that is right for you.